Dr. Meltzer, you've said now that the root cause of this whole major crisis, health crisis, is chronic disease, and that it represents 75% of the medical costs in this country. And for the most part, this chronic disease can be prevented.
That's correct.
If attacking chronic disease is not currently a centerpiece in healthcare reform, how do we get started?
There are things we can do both individually and collectively. It all begins with the individual. Healthcare reform begins with the individual. And how does that work? We need to make health a value. That's right. We need to make health a value. Health is precious, just like we have freedom as a value, just as we have justice as a value. One nation under God with liberty and justice for all. We need to extend that to being healthy. Wherever you go, talk to anyone who's an expectant mother. What kind of a baby do you want? I want a healthy baby. You see, we have to take pride in our health. We must make health a value for us to really have effective healthcare reform. Remember what John F. Kennedy once said, do not ask what your country can do for you, but what you can do for your country. And what we can do for our country right now is individually, for ourselves and our families, we can have an intention to be healthy and well. Collectively, we have a defining moment in our history. It comes down to a simple choice. We can either choose a healthcare system that empowers individuals or a disease care system that empowers disease. Currently, we have a disease care system. What does that mean? Well, it means that we don't teach people how to be well, but we try to maximize the efficiency of treating disease and managing illness. It's not preventing disease, it's treating disease. In other words, in our disease care system right now, it's assumed that disease is inevitable. Well, what I'm here to share with you is that disease is not inevitable. Yes, getting older is inevitable. Death is inevitable. But disease and chronic disease is not inevitable. There's a lot as an individual people can do to prevent disease. You know, the body was engineered to be well. And we all know folks in their 70s, 80s, and 90s that live active lives mentally and physically. So the key is to empower individuals with a healthcare delivery system, not to empower disease with a disease care system, which we currently have. It's time for a shift. It's time for a new way of thinking, a time for a new paradigm. It's time to switch from disease care to a true system of healthcare that teaches people how to be well. We need to empower the individual, empower the patient, empower the American public, empower individuals with the tools and the resources to be well. You see, the key is preventive medicine. Preventive medicine is a solution. Now let's take a look at the current administration's solution. This is their solution. One of these 50 squares has preventive medicine. The rest of this program is adjunctive. It's like the dessert. It's not the entree. Preventive medicine is the key. What we have to do is educate people about how to be well. Educate people on better living habits, better thinking habits, more sound eating habits, more positive fitness habits, learning how to manage stress. That's what we have to do to prevent disease. Individuals have to learn how to be accountable. Self-responsibility is the key. Healthcare reform without self-responsibility is not healthcare reform at all. Now here's my thought. Why not we become the very first nation that not only believes in health, that makes true healthcare a policy. True healthcare becomes our way of life. We work together individually and collectively to be well. A healthcare system based on empowerment, not a disease care system based on entitlement. We can be the first country to have true healthcare. It just becomes an extension of our values, an extension of what we believe.
So, Dr. Meltzer, if we understand you correctly, what you're saying now is that we cannot turn over the responsibility of healthcare reform to pharmaceuticals, to medical corporations, to the government, to businesses. It all starts with the individual. Is that correct?
That's correct. I'm saying that we have to turn to ourselves for our wellness, not to turn to insurance companies or pharmaceuticals or physicians for our wellness. We have to be responsible to create wellness for ourselves. That's correct.
I believe what you're saying now is that until we educate people and give them the tools to learn the insights for healthy living habits, this crisis will just continue to escalate. So how would you implement a healthcare system that has as a cardinal aspect to it for people to have wellness in themselves?
You know, there are 4 fundamentals to wellness. We teach them at our institute, the Meltzer Wellness Institute. And for those that are interested, you can go to maketimeforwellness.com and check it out. But here they are. It's like 4 legs of a chair. Very simple. All legs are strong, the chair is strong. Number 1, self-awareness. What role you play in your life health? What role you play in your health care? Your choices, your lifestyle decisions, your eating habits, your thinking habits, your activity habits. So, you know, it's very important folks understand that disease is not inevitable. Aging might be inevitable, but disease isn't. And so self-awareness, self-responsibility, self-accountability, that's number 1. The second leg of the chair is nutrition. Nutrition 101, what to eat, what not to eat, how to eat, how to combine your foods, what supplements to take. Very important factors because nutritional fuel is crucial to well-being, cornerstone of preventive medicine. Number 3, exercise. Everybody knows exercise is good for us, so we all need some type of regular exercise routine. And number 4, stress. How to manage stress. We need to learn how to manage stress effectively, how to reduce stress. So those are the 4 legs of your chair. Everybody, every American, every teenager, everybody in the United States can improve their health by looking at these 4 components. Number 1, self-awareness. Number 2, nutrition. Number 3, exercise. And number 4, stress management.